Actually, how it really happened was we were on a Zoom call and Nick said, "Okay, those of you that want to do this paper on voices of children, turn your screens off or turn your screens on." And I was too late in turning my screen off, so he assigned me. No, I'm kidding. It's a group effort, and I'll acknowledge all of our co-authors. Really, Rosie Kayermatang should be up here. She was the lead author. I was more the senior author. I'm obviously old, so I was the senior author. And I want to acknowledge also the contributions of Bray. I'm going to be using a lot of their drawings in our. I thought it was appropriate to have children's drawings on a presentation about the voices of children. I want to put it first. Take the first part of the talk and go back and have maybe PTSD around COVID and talk about what children went through with COVID. So January 20, the world changed. China announced that there was a new virus. This is a 2-year-old's drawing of that ugly, evil virus. And things really changed fast. This is a cartograph that shows the incidence or the number of cases by the size of the country, and that's China. That was in January. It quickly spread to Europe. Spain was early affected. I work in Ecuador, and many people working in Spain as work refugees came back to Ecuador. So Ecuador was hit too, but the United States quickly took on the virus. This is July 2020. By January 2021, 80 million cases of this virus. I mean, this is an unprecedented event in the world. People didn't know how to deal with this. People were dying of the virus. It was a very serious. We had over 1 million deaths in the United States, by the way. So it was a very serious thing. Shows you February. This is from Johns Hopkins. They were tracking the virus. The top shows you February. So about a year into the epidemic, there was 109 million cases, and those are only documented cases. So people people estimate that the underreporting is maybe tenfold. By a year later, there was over 600 million cases, almost 700 million cases, and almost 7 million deaths worldwide. So I just say this because this just changed everything. We all lived through it, right? We're all old enough to have lived through this. There are no 2-year-olds in the audience, are there? No. So this thing, I'm borrowing actually Dr. Kohler's slide here, but many things impacted children. I'm not going to go through them as she did, but I am going to go through how all of these things, as the world tried to deal with this crisis, we shut everything down. And we all experienced isolation. We all experienced changes in our jobs. Children experience changes in their routines and school closures and economic impact. And I'm going to go through some of that. So this was shows the epidemic worldwide, and it's divided by colors by parts of the world. And what I wanted to show was if you look at March, the beginnings over in March 2020 here on the left, if you go across, you can see almost over 3 years of this cycling of this pandemic, so that you would have these waves of the pandemic, and so schools were responding, workplaces were responding, public health was responding. Everybody was trying to get a handle on this thing. So if you look at this is a map of the school closures back in the April of 2020. Almost 2 billion children left school, just shut down. The entire world, if it's in red, except for Australia, if it's in red, basically the schools were closed. So almost all countries closed their schools universally. The next slide on the top is, can't see my date there. What date was it? March 31st. It's, oops, I want to go back. 22. So we actually should go to the bottom slide and then to the top right slide. So, but you can see that the point of this slide is that school closures waxed and waned. In the United States, we really struggled with it. We opened schools, and then if there was a surge, we might have new restrictions on school time, on masking, on all kinds of things. So it was a pandemic that changed over time. And one of the most important things is that among the children that are poor in the world, almost none, 2/3 of the 2.2 billion children that lost school did not have internet connection. I work in a very poor area of Ecuador, and they went to basically communicating the school assignments by WhatsApp. So they would send WhatsApp assignments. The poor, every family had a phone. For $5 a month, they could get a prepaid subscription, and WhatsApp was free. So WhatsApp actually saved a lot of children's education. I talked to the educators and asked, how much do you think the children are actually getting? They had children that would hike to the top of a hill to get the reception, receive their school assignments, go home, work on it, take photographs of it, and send it back to their teachers. So it was really an amazing, but the vast majority of children who were poor really struggled. And they estimated maybe 40% of what they were learning during the pandemic. They really, there was a huge impact on children. There was a very nice study by Save the Children early in the pandemic to look at the impact. And I think this title, Child Poverty, says a lot, that the indirect impact, the hidden impact, as they phrased it, was huge, bigger than the direct impact in terms of deaths. And I'll show you that some of the death rates of parents and children are low relative to the adults, but the impact on the poverty was huge. So they interviewed many children, and they interviewed many parents around the country, and almost 3/4 had impacts on their income. And they interviewed both the Save the Children constituents, but also non-poor parents and children. So this was such a huge impact on the economics of families. 85% of caregivers reported having trouble paying for food. You can imagine the stress that they're under. A third were struggling to pay for health care. And this just, when parents are stressed economically, the stress is communicated, as we talked about in the last session. Here's a quote, and I'm going to go through some quotes from family. My mother's anxiety caused by her, my father, and her brothers leaving their jobs scares me, especially that my little brothers have many needs to attend to. I want to go back to school for my father and for my father to go back to work. So, as Donna emphasized, there was huge impacts on play, on the increase in chores, mostly by female children, by girls. So, about half of the children in the world had significant impact on their routines. And we all know, if you've been a parent of a child, routine is critical, right? When kids go out of when your routine gets disrupted, whether it's even just for a vacation, behavior gets out of control, parenting becomes very difficult. So again, this Save the Children study showed a huge impact on children's worry, sadness, being bored, being less hopeful about the future. So there was just a lot of this enormous impact. This was a study done by Hillis to estimate the number of children that lost parents or caregivers. They lost caregivers. So they estimate that 10.4 million children in the world lost through death a caregiver. And now some children lost one caregiver and they had two caregivers. So they were not orphaned, but they estimated that COVID caused 7.5 million to become orphans. And a study in the United States showed there was a huge racial disparity, that 1 in 753 white children compared to 1 in 310 Black, 1 in 168 Asian, and Native American. I should say, that's Native American, the AIAN. Another study that, just to emphasize the impact on children, this was a study that was very complicated that went through how did COVID affect services for women and children. And they went through a very complex estimation of reduction of services. And they estimate that there's probably up to 4.5 million excess child deaths and up to 250,000 excess maternal deaths due to the fact that family planning, antenatal care, childbirth, prenatal, postnatal care, childhood vaccine, more children died of measles during COVID than COVID. So all these preventive services that were affected because personnel were shifted to deal with COVID away from these services. So they just stopped these kinds of services for children and families. So then we did this paper where we reviewed a lot. This is the group. This is my co-authors. I want to acknowledge all of them. Josh was, he was a research assistant with me, and he's now working in Mozambique after getting his master's in public health. And he did a lot of the work of, you'll see how many papers we had to sort through. So our objective was to look at the voice of children and really look at papers that talk directly to children, to find out the impact of the pandemic on them. I've put that in context. We did a comprehensive search of the literature. Again, this was early, the first year of the pandemic, right? So it was February 20 to February 2021. We identified over 8,000 studies, but many of them were about children and not speaking to children. So we eliminated a lot, and we came up with 28 studies. All of the authors on the prior page reviewed all 28, and we had multiple phone calls in addition to our phone calls with Nick. And we did a kind of a qualitative thematic analysis and identify these different themes that I'm going to share some quotes from these different themes that the children, and I'm going to let the children speak for themselves. So on mental health and mental health in play, I'm worried and afraid that something will happen to my grandmother. That's why I don't go to her house, because if she gets sick, I will feel guilty. A lot of children worried about their caretakers, especially their grandparents, because the elderly were dying at a much higher rate, and children knew that. We get depressed because of staying home. Maybe some children who stay in the rural areas can go out in the garden. But those of us from an urban area can only stay in their flats. I live in a fairly rural area. My daughter and grandchildren were 3 blocks away. We could walk, we could go outside and play. I just felt very fortunate. And I felt the people that were stuck in flats in very congested cities had a lot more trauma because of it. Social connectedness and culture. We can't see our friends anymore. And I haven't got much family, so my friends are more like my family, and I depend on them. Not being able to have them, not being able to have that human contact in person is really hard. That was a youth from the UK. Children cannot play together. It's very harmful for every child's mental and physical health. That was a 16-year-old in Bangladesh. Social protection was a theme. We stay at home, and despite the fact that isolation will help protect us from the virus, this will bring starvation that can still kill us too. And I showed you the economic impact. Again, I work in Ecuador. The migration, we talked about migration in the last session. The out-migration post-COVID is spectacular. Why? Because the people that were living year to year based on their crops, markets were shut down, and they didn't have a market to sell to, and their economy collapsed. So they're migrating out to survive. Social protection. My father and brother are no longer employed due to Corona, and there is a lot more people in the same situation, and they have households to provide for, and they need money. Big problem is lack of water. Many houses get water only once a week. So how are these people going to have good hygiene? That was a girl from Brazil. On education, we talked about that a little bit. My life and that of everyone in my country has been greatly affected since we've lost classes, and the teachers were not prepared for the online school modality. At this point, they have not explained the subjects and they do not give examples. And we do not know how much about the subjects we are taking online. The online courses, these kids were in, most of the parents where I work have a 3rd to 5th grade education. So their children at 7th, 8th, 9th, 10th grade. I can't do my grandchild's high school math. I can't do that. So the children were really left on their own devices and really struggling. And again, many didn't have internet access. Another quote from Pakistan: Mama and Papa are so worried to arrange laptops, tablets for online classes. Paying more for internet and full fee to school are too much. Many people didn't have the $5 to pay for internet phone access to internet. So there were nonprofit agencies that came in and helped families. Protection from harm. These aren't quotes. I just want to cite that globally, violence in the household was reported by children at over double the rate when schools were closed. And one of the things we thought about for schools is schools are observers of children. So if children are being abused in their homes or in their communities and they're coming to schools, schools are a protective factor that can intervene and report that and prevent and be a protective factor as well. And that was removed. In Kenya, sexual abuse, physical assault, and child labor were reported as much more common during the pandemic, with perpetrators coming from both within families and from the immediate community. Protection from harm. These are, I feel tired of home chores, and that was disproportionately for female children. I have a fear of teenage pregnancy and child marriage. Schoolgirls are the most targeted one in marriage due to school closure. That was a girl, 14-year-old in Kenya, where child marriage is illegal, but still happening. Child participation, they quoted, they're not listening to children, young people much at the moment. I personally don't think we have really had any kind of voice during the pandemic. We don't have any sort of representation. That was a female from Australia. So we took some articles described how children, and they had quotes from the children, how they were helping with the pandemic. And this first one is a child from the Philippines. I'm volunteering in my community to battle the coronavirus pandemic and raise awareness about the risks the virus brings to the population. I feel this is an opportunity to help others. Another child from Bangladesh had this idea that kids can talk on live radio programs. We can invite specialist physicians who can talk about solutions and guidance. That was a good idea. Another last one, we are conducting storytelling for children to keep them entertained and occupied. This helps children to stay at home and not go out in the streets. This is another girl, same girl from Brazil. So what were the recommendations that children had? They were very poignant. We want to feel we want free, dedicated play areas. A boy from the Palestinian from the occupied territories. We want more opportunities for persons with disabilities. Our life is always in quarantine. That was powerful. We asked for governments to spend more money to make sure that we can continue learning while at home. They must make sure that children in rural areas and from poor families also get to learn. And it was remarkable how many of the children's quotes, they were concerned about other children. I mean, it was great. It was really moving. So recommendations by children continued. Children should be protected from violence and beating everywhere, including at home and school. A 16-year-old boy in India. Protection from gender-based violence and the prevention of child marriage was another one that a child mentioned. And an end to war and a focus on bringing about peace. Wisdom from children. Work with children more. We are the future, and how you treat us now is how the future will look too. A very wise 12-year-old from Kosovo. So our key messages were that children were able to articulate the detrimental impact of the pandemic. They had a very keen awareness of what COVID was and how it was affecting their family. They were anxious and stressed by the pandemic, particularly as it affected them with regard to school and future prospects. Many children are very future oriented, so they were worried about the future. The children and youth in low income countries were very passionate about describing the economic impact on their family. And they really emphasized they wanted more information. They emphasized that they could be involved in making decisions, as we talked about earlier. And they wanted to be a stakeholder in the crisis response and not just be acted upon. And they felt, and when we recommend that their participation be tracked and reported to the Committee on the Rights of the Child. So I want to thank you. I want to acknowledge all the co-authors, all Dr. Lynch, Dr. Pinzon Seguera, Dr. Osai Bonsu, Joshua Fortman, and the Enrich group that was working on this. They all, like I said, we all read their articles and contribute to forming these themes and picking these quotes. Thank you very much.